Hi, Dr. Gullberg here, continuing our internal medicine series. Today we're talking about diastolic heart failure. Diastolic heart failure, really a term that was not used when I was in training 25 to 30 years ago. Now, of course, we see it used a lot. It's a common problem that we see in our patients. So how is diastolic heart failure different than congestive heart failure? Well, diastolic heart failure is defined as symptoms of heart failure in a patient with preserved left ventricular function. These people have normally ejection fractions that are over 50%. It's characterized by a stiff left ventricle with decreased compliance and impaired relaxation, which leads to an increased end diastolic pressure. Signs and symptoms then are very similar to congestive heart failure in those patients who have systolic dysfunction. Hypertension, LVH, is the most common cause of diastolic dysfunction, and BNP, of course, can be elevated in systolic heart failure or diastolic heart failure, and treatment is actually similar. The way it's diagnosed is simply on echocardiogram. Normally, in a normal heart function, the early diastolic filling wave is higher in amplitude than the atrial kick wave. What happens in diastolic dysfunction is that the E wave, or the early diastolic filling wave, decreases in amplitude relative to the atrial kick wave, the A wave, which goes way up because of the stiffness of the heart and the inability to relax. So that's really what we're looking at, is the E to A wave ratio. And that's what cardiologists look at when they're reading echocardiograms. So just to give you an update on diastolic heart failure, now you know what it is, and be looking for it in your patients. Thank you, Dr. Gullberg, signing off.